Okay, so today's topic, benign prostatic hyperplasia. I decided not to try to draw a prostate because I'd have no idea how to. This is a fairly common condition of older intact male dogs, and just the same as people or men get prostate enlargement with age, so do dogs. So this is very different to prostate cancer. Prostate cancer in dogs is actually quite different to in people. In people it tends to be very much a hormonally driven thing. In dogs, prostate cancer itself doesn't tend to relate to testosterone, but benign prostatic hyperplasia or prostate enlargement is very much testosterone driven. So basically the prostate is part of the reproductive tract, and in a normal young dog will actually sit just over the top of the pelvis. So when we see a male dog, an older intact male dog, then quite often at their annual health checks we might do a rectal exam to check the size of the prostate, which is just a digital exam. Not very pleasant for the dog, but it's quite an important thing to keep an eye on. As the prostate gets bigger, what we start to see, in most cases, a bit of enlargement is very well tolerated. So the prostate will start off sitting in the pelvis here, but as it gets a bit bigger, it will tend to push down and out of the pelvis. So we may find when we're doing a digital exam, we can't actually feel the prostate. We may find that by pushing up on the belly, we might then be able to feel it. But when we get very advanced prostate enlargement, what happens is the prostate starts to fill the pelvic canal, and that can cause a couple of problems. It can cause problems with urination, just because we've got this big thing sitting around the urethra, but also because we get the prostate sitting up here in the pelvic inlet, then it can actually cause the dog or stop the dog from being able to defecate effectively, and so it's basically forming a big plug in the pelvic inlet. So benign prostatic hyperplasia, it's a fairly easy thing for us to treat. Castration is the obvious treatment of choice, and that allows the prostate to reduce in size quite quickly. Depending on how the dog presents, so if it's having trouble defecating, for example, we might want to correct that before we actually take the dog to surgery. So we might recommend some form of chemical castration. So that can either be through an injection, which lasts about 4 weeks, or we may look at putting in a longer lasting implant. The longer lasting implants actually, it's sometimes called chemical castration. Those implants can last for 6 to 12 months or sometimes even longer. So people who decide not to castrate the dog, or if the dog's maybe a poor candidate for surgery, if it's got a bad heart, if it's got other concurrent diseases, we may choose to go down the path of chemical castration long term, but normally we'll try to just reduce the size of the prostate and then do a physical castration, and that way it's a permanent sort of cure. So yeah, it's a pretty easy thing for us to deal with, and yeah, if your dog has that problem, we're going to be able to deal with it no problems.